Thank you for the introduction. I'm a physicist, and I'm part of this team with a physician also from the hospital. And this work will talk about from the evolution of this searching for a technique for diagnosing malignant tissue of thyroids in thyroid surgery. So, I'm from the physics department of the University of São Paulo. And I work with optical dosimetry spectroscopy, so we have a lot of techniques that we are looking for healthcare. And another team is from the hospital, from head and neck department, Clinical Hospital of Ribeirão Preto, also in São Paulo University. And it's a huge hospital. We have a lot of surgeries per day, and specifically for head and neck, from where we use our samples, we have near 4,000 surgeries per year, and from this group we select our samples. And what the clinic bring appel from us, as come from the clinic, as our co-partners bring to us, is to differentiate differentiate health and benign from malignant thyroid tissue. And in the first step, we don't want to differentiate these lesions here, but you want to differentiate only benign from malignant tissue, because that is the big problem for a surgeon. And so we conduct this work. The first that I want to show is why it's important to differentiate benign from malignant, because the thyroid, if you have some benign tissue, the procedures is to remove part of this thyroid, and if you have a malignant tissue, you remove the total. So it's important to know if the tumor that you are removing is benign or malignant, to make some more preservative procedure. What the clinic have today is two diagnoses, routine procedures. The first is a final needle aspiration, where you make a biopsy and is routine. But the problem is, the only disadvantage of this technique is that you have some follicular neoplasm, and this technique does not differentiate very well between benign and malignant. So if you make a biopsy, you have some classification like benign, indeterminate, neoplastic, malignant, and diagnosis and no diagnosis categories. If you have neoplastic and malignant, you are indicated for a surgery. And in the surgery, if you have malignant, remove the entire thyroid, the total thyroid, and you have a neoplastic, you have another diagnosis procedures named frozen section. That is a fast pathology analysis during the surgical procedure. The disadvantage of this technique don't give more precise information for the surgery. One example is that in the literature you have, from the follicular neoplasm, you have only 20% as malignant. That means that 80% of these samples from these patients, the best option was to remove part of the thyroid and not the total thyroid. And for frozen section, the big problem is you then not change the operative, because you don't have more precise information for the surgeon. So the proposal is, during the surgery, to search for a technique that makes some analysis of the tissue, that you remove the tumor from the surgery, and can be fast and carry biochemical information as optical techniques. And in literature, you have some Raman spectroscopy, Fourier transform, scattering spectroscopy, other techniques, static fluorescence spectroscopy. But we are searching this work here is a new technique. It's a time-resolved fluorescence spectroscopy. And why time-resolved fluorescence? Because when you measure the fluorescence lifetime, you are measuring a parameter that is not changed if you change the fluorescence. That means if you have a low signal, the lifetime is the same for the same sample. If you have pigmentation, that's a typical problem also in biological tissue. This pigmentation do not change these parameters. And also the fluorescence lifetime is a characteristic for biochemical and environment. That means for a specific fluorophores, when when you excite the lifetime is a molecule is the molecule when the lifetime is the time that the molecule spends the excitation level before emitting the fluorescence. So the excited state is unstable, so the fluorophore that means the fluorescence transition occur faster or slower depending on the molecule, depending on two parameters, the molecule structure, electronic structure, but also the environment. If you have a different environment, you have different lifetime values. That means if you have different tissues, different conditions, different environment in the tissue, you have changes in this lifetime. So this is a promotion, is an interesting parameter you have used to diagnose lesions. And the instrumentation that we have in our laboratory is three. The first is if you have ex vivo samples and you can ground these samples, put in cuvette and measure in a typical fluorescence spectrometer. The second is coupled optical fiber like this one here, and you direct excite solid samples and collect the fluorescence signal. Other possibility is to use microscope systems that you have image, not this one. This one is an example from PicoQuant. And for this work, we choose optical fibers because you don't have sample preparations, and that is good because you can make a faster answer, faster results. When you excite the sample with optical fiber, part of this is taken as reference, and other part is excite the sample, and you measure the fluorescence, then you build such kind of histogram. For this experiment, we use as a reference when the fluorescence reach 1000 counting. That means if you wait more time for fluorescence signal measurement, what you have is an increase of this curve. But if you have more signal, you not change the lifetime value because the lifetime is unaffected by the amplitude or the background. So that is what we measure. The sample that we use two sets of samples. The first set was for a ground experiment, and a second set of samples we use for fluorescence lifetime spectroscopy. And the sample was removed during the surgery, kept in phosphate buffered saline solution, and from the surgery up to transportation to our department and to make the measurement, we spent 2 hours. And the surgeon separate for us a very small piece of tumor, very homogeneous, and the half of this part was sent to the pathology analysis and another part to us to make the fluorescence measurements. Remember that our objective is to differentiate benign from malignant tissue, but before that, using fluorescence spectroscopy, time-resolved fluorescence spectroscopy. But before that, we make some experiments using absorbance and static fluorescence to understand a little more what happened with the tissue when you radiate with different wavelengths. For that specific ground experiment, we use another set of samples of 17 human thyroid samples. We ground this sample to put in the cuvette to make these measurements. For this, we observe a typical absorbance for tissue where you have hemoglobin bands, protein bands, by this example probably are thyroglobulin. And what we observe here, we don't make a precise absorbance, scattering measurements, but we have a high absorption for wavelength lower than 290 nanometers. That means if you irradiate with the excited sample with 208, 207, you don't irradiate so much tissue, so you make a more superficial analysis, fluorescence analysis. That is not so good because when you want to make analysis, you want to analyze all the sample. And other problem that we have is to access the biochemical information from the tissue is important to excite ultraviolet radiation, spectral region, because so you have more bands, you have more signal, and you have more biochemical information to give you an answer and use to differentiate from benign to malignant tissue. So using the absorbance spectrum, the best option for us is to radiate in this spectral. Here we are showing different tissues, but it's not to differentiate, it's only to give example that we have in the absorbance spectrum. The absorption peaks are almost the same for different groups. And, but it's important to remember that we are not concerned with absorption bands of thyroglobulin or proteins. We are looking to fluorophores. So in our biological tissue, we have this kind of fluorophores. More precise, we have tryptophan, and you have a huge absorption band near 290 with fluorescence at 350. Another two examples is nadim and phadim, absorption near 350 nanometers or 300, 500 nanometers. And these are probably the fluorophores that will give fluorescence in our tissue. The second experiment that we use is a static fluorescence. Here we select excitation wavelength and measure the fluorescence over different range and over different range of excitation wavelengths. And you observe that you have a very high value for this excitation and very lower, and you excite in the visible or in the UVA or blue spectral region. That means that you have a good signal when you excite in this region here. And third experiment that we do is to optimize this process is to fix the fluorescence. That means that you are fixing this wavelength here. You measure only at, by example, 330 nanometers, and you change the excitation wavelength so that you have a best performance when you excite in 290, by example. And in this here, we have also a peak near 450, 475 nanometers. That is, in summary, that the best choice is excite in this region here and measure the fluorescence at 350 or at 450, 475 nanometers. The system we use for this experiment is not a compact system, it's a table, it's a large system. The most part here is to select the wavelength. And this wavelength is split in a reference and other to cope to the optical fiber. Here is the sample, here is on another view. And the fluorescence is collected and sent back to the monochromator, to the photomultiplier, and compared to the reference, and so you can measure the lifetime of the fluorescence. What we have here is result as we excite with only one wavelength and measure the fluorescence at 340 and 450 nanometers. And for each measurement, we adjust exponential. We have two sets of lifetime. A small value near 1 nanosecond and a second set near 4 or 5 nanoseconds. Here we observe that we can separate malignant from benign tissue with two statistical methods for these two sets. For emission at 450 nanometers, we cannot separate because in this spectral region here we have a lower fluorescence. So lower fluorescence, you have more deviation, also more more difficult to separate the groups. But almost we have here also difference between the groups if you look to the second lifetime value group. And that means, in conclusion, that using these parameters, you can separate malignant from benign tissue. And that indicates a promising technique for application as a real-time assessment for thyroid lesions using ex vivo samples. For our collaborator told me that it's not necessary to make a measure inside the thyroid, because when the patients to their surgery, you open the thyroid, the doubt is which tumor is malignant or malignant. So the surgeon will remove this piece and send us for ex vivo analysis. That is the reason why you use ex vivo and not direct in the thyroid. But before conclude this presentation, I'm going to show that our system is not a compact, but we have in the mark more compact system, so that we want to translate this for a clinical procedure. It's very easy. And second, what we talk is about the dispersion of this data. This work continues. We want to reach for better results, but before to increase our data bank, we want to understand more why we have so big dispersion. By example, for 340 nanometers, for the healthy, benign, malignant, you see for the benign group here for this lifetime, for the short lifetime, or for the longer lifetime, you have a big dispersion for benign tissue. So, to understand a little more, we will start now to measure the tissue slice, to understand from which place from the tissue, which part of the tissue we have different lifetime values. This is not thyroid tissue, this is also an example from PicoQuant. This system we have in our laboratory, and we try to make similar experiments and to have access and diagram, how can I say, a frequency, how different lifetimes you have and the intensity, and to try to correlate to the dispersion that we have in the optical fiber experiments. And also to that we have collaborators that want to measure in the same sample some biochemical information. We try to use immunohistochemistry or also another optical spectroscopy technique that can reach more biochemical information like infrared or Raman spectroscopy. So that is the work for the next year, and to try to improve these results that we have with fluorescence. I want to acknowledge the grants, fellowships, and thank you for the attention.